Hi, my name is Kathy Kennedy. I'm a constituent from Kent, Washington in King County. I'm joined today by 4 other Lyme advocates from different parts of our state. We're going to take a few minutes to go over 6 appropriation requests. And just to give you some background information, over the last decade, nearly 500,000 Americans got Lyme disease every year. Up to 20% or 100,000 Americans suffer from chronically persistent Lyme symptoms. The available diagnostics to us are unreliable and there is no cure, despite over $100 million of privately funded research. We need our government to be our public partner in diagnostic R&D and to find a cure. We're asking for support to increase funding for Lyme disease prevention and research in the FY22 appropriations process. I'm going to talk with you today a little bit about the Kay Hagan Tick Act. It was signed into law in 2019, and that bill gave authorization for $150 million of funding over 5 years. For FY22, we're asking for $30 million in funding in 2 areas. The first is providing $10 million to award grants and agreements to higher education institutions for regional centers of excellence and tick-borne diseases. Lyme disease would be granted the higher funding weight as it's the most common vector-borne disease in the US, according to the CDC. The goals for the allocation would be to facilitate collaboration in surveillance, prevention, and response activities. Also, it would provide training for entomologists and other healthcare professionals. R&D would develop methods to anticipate and respond to disease outbreak. There are many parallels and similarities that can be drawn between COVID-19 response and the tick-borne disease response over the past 40 years. A few of these parallels and similarities both began as a cluster of diseases, both rapidly evolved to hyper-endemic issues and response. And then also there's the confusion of the patient of whether they actually have the disease or have had it. These are just some of the different experiences and parallels, and there's many more. There's also the long-term effects of COVID-19 that we're starting to see, which also parallels with chronic Lyme disease. So we're also asking for $20 million in entering into agreements with state health departments and tribal organizations. These agreements would increase the capacity to identify, report, prevent, and respond tick-borne diseases and related outbreaks. I was bit 30 years ago. And it was here in Washington State. I was told we didn't have Lyme here. That particular perception is still prevalent today. And that is where this collaboration and training with higher education and universities could change that. I am the face of Lyme. I graduated from Wazoo, and I had plans to go to law school. And that came to a screeching halt. I was bit, and from that point on, I struggled to get diagnosed for 5 years. And then I wasn't properly treated for another 10. And I've been in treatment off and on since then. I was fully diagnosed initially at the University of Washington. And unfortunately, for about the last 5 years, University of Washington will not see Lyme disease patients anymore, with no explanation as to why. With this being such a large research and teaching hospital, they have different satellite offices all across Washington State. And so it has far-reaching effects that they will not see Lyme patients. With that, over the past 30 years that I've had these ups and downs, I've had several heart issues, including heart attack. I've had strokes, nerve damage, and major neurological issues. And these are just a few of the many symptoms that I've had. I've spent over $500,000 in medical expenses for my chronic Lyme, and I am just starting to get back to being able to work a few hours a week. We're asking that you fund the Tick Act. And that will help with us to be able to know that we're going to survive each day. We deserve to be able to know we're going to survive each day, and we want and need to live full lives. I'm going to pass it over to Roxanne now.
Hi, I'm Roxanne. I live in Kent, Washington. I am one of the many constituents in Washington state that has been impacted by Lyme disease. My 2 children and I suffer daily from Lyme disease and the many co-infections and disorders that came along with it. I went from a contributing member of society working full-time as a business director for a nonprofit organization to bedbound overnight. Over the last 6 years, this illness has cost my family over $620,000 financially and has taken an unquantifiable toll on all of us physically and emotionally. I've had years of my life and years of my children's lives that have been taken from this disease. It took 5 years, seeing 30 doctors before I was accurately diagnosed. I was misdiagnosed with many things before asking to be tested for Lyme disease, being turned down by one doctor, and finally being tested by another, where I tested clearly CDC positive, and then finally got access to treatment that I needed. The number of reported cases of Lyme disease in the United States today are nearly 5 times what they were in 1991. Lyme disease is a rapidly growing health crisis. One model predicts that by 2050, Lyme disease will infect 55.7 million people in the United States, or 12% of our population. Current diagnostics don't work, missing up to 60% of acute cases, and there's currently no test that can rule out Lyme disease. Conventional treatment for Lyme disease fails in 20 to 66% of acute cases, leaving many patients with lingering illness and no approved treatment. Per patient funding for Lyme disease is incredibly low, at $63 a patient. Less common diseases, West Nile virus and malaria, have 200 times and 1,800 times the amount of per patient funding. You can help us by supporting the request for an increase in funding of $20 million for the 2022 fiscal year to total $101 million for the NIH and their ongoing Lyme disease and other tick-borne disease research. This funding will help develop reliable diagnostics that are desperately needed and therapies to address this increasing U.S. health concern affecting over 476,000 new Americans annually. We hope that we can count on you for that support. Thank you so much.
Hello, my name is Jennifer Hyla. I'm a constituent in Paulsbo, Washington and Kitsap County. I'm asking for support and an increase in funding for the Congressionally Directed Medical Research Program, acronym CDMRP. This program's mission is to understand the pathogens of Lyme disease and other common tick-borne illnesses, to deliver innovative solutions to prevent, diagnose, and treat the manifestations for the benefits of U.S. service members, and then to disseminate this knowledge to the public. This is very important to me because I contracted Lyme disease during my military service. Due to the lack of awareness, I was misdiagnosed by military doctors for 4 years. I developed the neurological symptoms of Lyme disease, becoming unemployable, bedridden, and it took me asking for a Lyme disease test before learning I had late-stage Lyme disease. 5 years and 5 appeals later, I am still fighting for service connection through the Air Force and the VA. Knowing how important veterans issues are to our representatives, I really hope I can count on this support for an increase in funding for peer-reviewed tick-borne disease research. Established in 2016, the Tick-Borne Disease Research Program provides ongoing research by the DoD to benefit military members and their families. But during fiscal year 2019, only 13% of the proposals were funded. So there is a huge need for more resources. We're asking for an additional funding of $5 million to equal $12 million allocated for fiscal year 2022 for tick-borne disease research. This increase is well justified as our military members are at one of the highest risks for contracting this illness. So I really hope that we can count on your support to increase the funding for Congressionally Directed Medical Research Program. Thank you so much. I'm going to pass it to Rebecca.
Hello, and Thank you for taking the time. My name is Rebecca Vitzman, and I'm a voter from Tacoma, Washington, and a board member of Lyme TV, a 501c3 nonprofit organization dedicated to educating the global community about Lyme and other tick-borne diseases. I'm here today to ask you to fund a national framework for the prevention and control of vector-borne diseases in humans. While there's been funding for the Kay Hagan Tick Act, there has not yet been funding for the actual implementation of this research. We're asking today that $5 million seed funding be applied to significant interagency research and coordination to commence work on the development of a framework. The goals of this framework will be to help us understand when, where, and how people are exposed, getting sick, or dying, develop, evaluate, and improve tools and guidance for the detection, diagnosis, prevention, and control, develop and assess drug and treatment strategies, and to disseminate and support the implementation of public health products, tools, and programs to prevent, detect, diagnose, and respond to vector-borne disease threats. I believe this is relevant to Washington State because while our in-state infection rate can appear lower than other states, we're not actually testing in the state of Washington. We have no idea of the scope that it has on Washingtonians. Our communities also have people coming in from all around the world. It has been shown that climate change has an impact on tick populations, and as our planet warms, tick-borne diseases will continue to increase, as well as the effects on our state and global community. This research and its implementation not only paves the way for those affected now, it will be very important for our future as a species as well. I hope we can count on your support to fund the implementation of this research. Thank you so much for your time and consideration, and I'm handing you back to Jen.
Thank you again. My name is Jennifer Hyla. I'm a disabled vet in Kitsap County, Washington. I'd like to bring your attention to the U.S. Department of Health and Human Services, HHS, LymeX Accelerator Implementation Program. The LymeX is an innovative public and private partnership designed to strategically advance tick-borne disease solutions in direct collaboration with Lyme patients, advocates, academia, nonprofits, industry, and government. Inspired by the success of the Kidney X program, the Stephen and Alexandra Cohen Foundation has provided $25 million towards this incredible effort, with goals to advance treatment therapies, facilitate education and awareness, and to develop next generation diagnostics. The goals of the LymeX program are important to me because, like so many Lyme patients, I was misdiagnosed for several years due to unawareness, missing that critical early window for effective treatment. I was misdiagnosed with arthritis by military doctors and treated with immunosuppressive steroids as the bacteria that causes Lyme disease made its way into my central nervous system, causing disabling cognitive and physical symptoms. Despite years of expensive and invasive testing and treatments, I am still fighting for my health every single day. My experience is incredibly common. According to the International Lyme and Associated Disease Society, the average Lyme patient takes 2 to 5 years to be properly diagnosed, and 1 in 5 Lyme patients fail that standard CDC treatment protocol to go on and develop chronic illness. The goals of the LymeX program can offer Lyme patients new diagnostics and treatment options, as well as curb new cases, but HHS has yet to allocate enough funds to execute the use of the Cohen Foundation's generous donation. Initial seed funding of $2 million was allocated for fiscal year 21, but a sustained budget of $5 million is required to achieve the lofty goals of the LymeX Innovative Accelerator Program. So I hope we can count on your support for this sustained funding. Thank you again for your time. I'm going to pass it to Jessica.
Hi, my name is Jessica Devine, and I live in the state of Washington. I am here seeking your support for the initial funding of $5 million to begin surveillance and address chronic Lyme disease. Chronic Lyme is the most common vector-borne disease in the United States. Over 476,000 people get diagnosed every single year in the United States. It is found in all 50 states with countless cases in Washington. I'm passionate about surveillance because my daughter and I both suffer from this disease. It took 30 doctors over 4 years to finally get properly diagnosed myself. I was then denied by 25 doctors thereafter when I seek treatment. My good friend lost her 22-year-old daughter to this disease, so it's very close to my heart. I spent years being bedridden, losing short-term memory, having vertigo, extreme pain, with daily seizures. My poor children had to witness all of this. I am now considered permanently disabled. My own daughter had to stop attending school for almost a year due to her symptoms. I feel with proper funding in these areas, a lot of our suffering could have been prevented. I help run several support groups, and I've witnessed the suffering of people from all around the country. In my group Rise Above Lyme, I hear thousands of stories just like mine. It has been shown that the CDC Lyme test failed to accurately diagnose 71% of individuals presenting with a Lyme rash. My own experience shows this, as my first test was negative, only to be retested and be CDC positive. Sadly, this means many patients go on thinking they do not have Lyme. I was misdiagnosed with MS, fibromyalgia, chronic fatigue syndrome, as well as early Parkinson's and early Alzheimer's for 4 years, to give you an idea. Persistent Lyme disease meets the definition of chronic illness because, according to the US public health definition, any disease that persists for more than 3 months is considered chronic. Research shows that a high percentage of Lyme patients experience ongoing symptoms, which are severe and debilitating, and I can tell you firsthand that they are. Hundreds of peer-reviewed studies have been done on Lyme treatment failures, and they've proven lingering symptoms are caused by the persistent infection of the bacteria that causes Lyme disease. After many years of extensive treatments, I have yet to resolve my symptoms. Patients are also forced to pay out of pocket for out-of-network doctors in order to save their own lives. This has financially devastated my family. In 2019, the Federal Tick-borne Working Group determined that persistent Lyme is disabling. I am asking you to support CDC funding to begin surveillance of persistent Lyme disease. I hope I can count on your support, and I want to thank you for taking the time to listen to my story. I'll pass it to Kathy from here.
Thank you, Jessica. We want to thank you for taking the time to listen to our stories. We all have varied stories, but we have so much in common. We ask that you think about the millions of Americans with Lyme disease, and that we have thousands of cases here in Washington state. We are faceless at times and hopeless in a healthcare system that seems to have just pushed us aside. This funding and research is critical for Lyme disease. To recap, what we're asking for is funding for the Kay Hagan Tick Act for a total of $30 million. To fund the NIH Lyme Disease and tick-borne diseases research for a total of $101 million. Peer-reviewed tick-borne disease research for $12 million. Also funding for the National Public Health Framework for $5 million. LymeX Innovation Accelerator funding of $5 million. And finally, to fund the tick-borne chronic disease prevention and health promotion for $5 million. We're asking for your support, and we would like to know if you will support these 6 appropriations. Please don't hesitate to ask us for further information regarding our Lyme journey, and we want to thank you again for taking the time to listen to our stories and consider these appropriations.